Hello and welcome to our presentation on the diving bell and the butterfly. The students involved in this presentation were Jennifer Hammond, Catherine Larson, Melanie Martinez, and Lady S. Locked-in syndrome is the result of a brainstem lesion, most often to the pons region. There are three main causes of locked-in syndrome, which are infarct, hemorrhage, and trauma, with infarct occurring in 60% of the cases. There are three types of locked-in syndrome that have been identified in the literature. Classical locked-in syndrome is when the patient is fully paralyzed but retains vertical eye movements and consciousness. Incomplete locked-in syndrome is where some motor function other than vertical eye movements is retained, usually movement in the feet or toes, and also retains consciousness. And finally, total locked-in syndrome is where the patient has no motor function at all, but still retains consciousness. In these instances, an MRI is required to confirm consciousness in the patient. Locked-in syndrome is defined as loss of whole body function, except for in most cases, vertical eye movements and anorexia, which is the inability to produce speech. In all types of locked-in syndrome, consciousness is preserved, and studies have been done to show that cognitive abilities remain mostly intact unless there is another part of the brain that is affected. So what happened to the author? The author, Jean-Dominique Bauby, woke up perfectly healthy and went about his day. In the evening, he got in his car and he was about to drive when he started to feel dizzy. All of his symptoms appeared in a matter of hours. By the time they got to his sister-in-law's house, he had lost motor control of his body, and he described feeling his head, no longer under his control, wobbles on his neck. As the doctors rushed him to the hospital, he goes into a coma. He is determined to have suffered a cerebrovascular accident or stroke, which is caused by a blockage or a broken blood vessel in the brain. The stroke puts him into a 20-day coma, after which he comes out feeling groggy and only able to move his left eyelid. The author's consciousness remains intact, where he knows and understands what is going on around him, but he is unable to communicate except by means of his left eyelid using a specialized alphabet. Jean-Dominique Bauby died of heart failure at the age of 44 while still in the hospital. This impacted his communication greatly. He was unable to speak, although he knew what he wanted to say. He was only able to communicate with the blinking of his left eyelid. He used an alphabet in which each letter was placed according to the frequency of its use in the French language that he used to communicate. People would come in and read off the alphabet until, with a blink of his left eyelid, he stopped the other person at the letter to be noted. This was repeated until a word, fragments, and eventually a sentence was formed. Bauby could only communicate if somebody was physically present with him and went through the process of the alphabet to decipher what he wanted to say. He dictated letters to send to his friends this way, so he could keep in touch with them, but obviously this was a much more time-consuming and difficult process than it used to be for him. When he was on the phone with his children, it was always quiet on his end, with his children carrying the conversation. Bowie's personal relationships were also impacted by this. He did have visitors come by, including his children, friends, ex-wife, and therapists, but he did feel a disconnect. He noticed that his friends and family saw and treated him differently since his accident. Bowie's quality of life was also greatly impacted by this as well. He was not able to communicate his wants and needs or live his typical life as he was used to. He had to depend on others for all daily living activities, including bathing, feeding, and getting dressed. He was very depressed at the beginning, but eventually was able to accept his disability. But he was also not able to engage, communicate with, or raise his children anymore. He often felt frustrated because he felt like a prisoner in his own body. In a situation similar to this, I would want to acknowledge the feelings that the individual may be feeling, such as fear, panic, anger, or frustration. It would also be important to explain what happened and what is going to happen moving forward. This could include providing a thorough explanation of the diagnosis and outlining different treatment options, including the different therapists and doctors that would be working with the patient and explaining their roles. Following this, it would be important to see if any clarification was needed from the patient. It is important for them to feel as though they have a voice in this situation. AAC stands for Augmentative and Alternative Communication. AAC systems and devices are varying methods of communication that help individuals that are unable to communicate due to physical or intellectual disabilities. Augmentative means to augment or add to someone's speech, and alternative means a different way of communication. There are technological options and non-technological options available. Non-tech options would include pointing to pictures, words, or letters, writing, drawing, or something similar. Technological options would include using apps, iPads, or other computer-generated devices to assist with speech. They may be speech generating or non-speech generating. The speech generating devices may involve pre-recorded phrases such as "Hello, how are you?" or "My name is Jean." Or they may have a text-to-speech voiceover in which a voice, similar to Siri on an iPhone, reads words a person has typed aloud. Bowby would be unable to use traditional AAC devices requiring voluntary movement. For this reason, I would recommend a BCI or brain-computer interface device. These work by tracking a person's eye movement to communicate what they want to do. They use a tablet-like interface with icons they can choose through eye movement to write a message, read pre-recorded phrases, or even access social media, among other uses. Feature matching is crucial for choosing an AAC device for someone with impaired communication. Feature matching focuses on a person's strength to ensure the correct AAC device is chosen, maximizing usage and communication output. For individuals with locked-in syndrome, an SLP may be able to support the individual with swallowing and nutrition. Feeding tubes must be advanced slowly. Recovery of swallowing may be possible for some patients. Once spontaneous swallows are noted, the SLP can assist with introducing small volumes of liquid and pureed foods. They may also be able to provide support with breathing and the management of tracheostomy and ventilation. Individuals may eventually be eligible for decannulation if they have recovered a spontaneous or voluntary swallowing of oral secretions and have an effective spontaneous cough. The SLP can assist with all of these things. Some questions we wish we could ask the author include, did you see yourself leaving the hospital and returning home to a semi-normal life, or had you made up your mind you would spend the rest of your life in the hospital? What advice or support would you give to other people with locked-in syndrome? And what do you appreciate the most or want from others when you're communicating with them? Do you like when others try and finish your words and sentences, or do you prefer to finish them on your own? In summary, Jean Dominic Bowby suffered a cerebrovascular accident which is caused by a blockage or broken blood vessel in the brain. This left him with locked-in syndrome, where he lost all motor control of his body except for the blinking of his left eyelid, while his consciousness remained intact. Locked-in syndrome affected his communication, relationships, and overall quality of life. SLPs are able to help with swallowing and nutrition, as well as with breathing and tracheostomy management. In the book, he used alternate means of communication by using the ESA version of the alphabet, in which he communicated by a person reading each letter in the order they appear and Bowby blinking at the letter to be noted. This was continued to form words, fragments, and phrases. Alternate AAC devices that he would be a candidate for are brain-computer interface devices, since voluntary movement is not required. This concludes our presentation on the diving bell and the butterfly. Here are our reference pages, and thanks for watching.